two jobs. I am a professor in the Graduate School of Public Health at San Diego State University, and I'm also Director of Research for the San Ysidro Health Center, which is located in San Diego also.
So, what role has the Latino Caucus played in your work and professional development?
The Latino Caucus was one of the first national organizations that I got exposed to in my health career, and I think the role that it played was the inspiration that was provided by some of the founding members and the membership at that point in time. There were a lot of individuals that were socially and politically active, and they inspired me to go on in my personal career in my area of the country to carry the torch and to pursue the same goals and objectives that the Latino Caucus was, but at a smaller level. So it was very inspirational at that time, going to school in major universities where you were a minority, but then coming to APHA Caucus, Latino Caucus, and seeing all the Latino professionals around you in the different areas was really inspiring for me to continue on and to keep going in spite of all the struggles that I was facing in my career.
So how did you get to where you are today? And please tell us a little bit about your background and what inspired you to pursue a career in public health as a Latino.
Yeah, that's interesting. Well, I think there were two major, turning points in my life that got me oriented towards Latino health. And the first one was back in the 60s. I worked with my older brother in the farm worker movement of California. And during my high school years, he pulled me out of my comfortable existence in the lower middle class area of Los Angeles, and we went to work in Arizona with the farm worker movement. And there was a large group of us living in one house, but all sharing the same La Causa at that time movement towards farm worker health. And it was really inspiring because for the first time I think I really got a social political consciousness about things. But one of the things that struck me about the farm worker movement was the poor health conditions. So as a spin-off from that, I decided in undergraduate school to go on and pursue a career in health. And then I think the second thing that inspired me was being part of the Latino Caucus and seeing the many dimensions that I could achieve that goal through the health careers. When I was in undergraduate school, I was thinking more about health administration at the time, and I was thinking that maybe be a director of a community health center at some point in time. But about midway through my undergraduate career, somebody said, well, if you really want to change health, you should become a physician, because there were so few of us back then. And I said, wow, that's really a powerful thing. Is that, if you're a physician and you're in health, you can do a lot more things. So I took that challenge up, and I went on and got a career in medicine. But after I got done with my medical degree, I decided to shift gears from family medicine going to public health and preventive medicine. And I think that was a big change for me. That big change happened one day in my internship when I was in an intensive care unit with an individual that was really homeless and nameless, and we were spending thousands or millions of dollars on his care, intensive care, which he needed, but it just highlighted to me the fact that we weren't spending enough money on prevention and public health. So I resigned from my family medicine residency and went into public health and preventive medicine. Stumbling blocks? I would just say, I don't know if there were really. That's a good question. I don't think I really not succeeded, because once I set my path, I just really kept going and I survived. But well, I know one of the big stumbling blocks. Well, it wasn't a stumbling block, but it was a challenge. And this is a historical event. The year I applied to medical school was the first year that there was a reverse discrimination case for medical students. I don't know if you're familiar with the Bakke case. There's a similar case before the Supreme Court right now, but the year that I applied to medical school was the year that the Supreme Court decided what was called the Baki case at that time, where a Caucasian medical student applicant sued the state of California for reverse discrimination, and it took about 10 years to get through the courts, but the case was decided the same year that I applied, so I had no interviews in California for medical schools at that time, and I was forced to go out of state when I really didn't want to because, you know, I grew up in California. But I tried to turn it into a positive, and, you know, living in California for so long I'd never really seen snow, so I decided to learn to ski. Now I love it. But I can't really say that I had significant challenges. I've just been really lucky, actually, to get to where I'm at right now. I'm pretty successful, I think. But anyway, scratch that one off. No challenges. I'm either good or very lucky. Very good or very lucky.
What advice would you give a Latino or Latina student that is pursuing a career in public health, and what do you wish someone would have told you when you were pursuing your career?
Well, I think the advice that I would give to young Latino public health experts is to stay involved in the community, work with large groups. You know, if you can get mentorship, that would be great. I think the thing that I wish I would have known a little bit more was about all the opportunities that exist in health and how to work more collaboratively in the Latino community. I think policy is a really important factor, and probably wish I'd known a little bit more about policy and public health earlier on. I've always been, you know, an individual level type of person, but policy is so important in Latino public health that I really think more of us need to go into it, and not to be afraid of challenging the system and changing the system with our politics.
So research questions now.
Okay.
So what are some of the soft skills that researchers need to advance in their careers?
I think some of the skills and research that Latinos need a little more mentoring in and exposure to would be learning how to collaborate with majority researchers. A lot of us, when we go into Latino research, think that we can only work with Latino faculty or other Latino researchers, but you really need to be pursuing the scientific expertise that you need to achieve your goal, and recruiting non-Latinos to work with and educating them and indoctrinating them in the goals of Latino research, I think, is one of the skills that really can't be taught out of the textbook. You really have to find those people that have the science and the potential for the same passion that you might have for doing Latino research.
And last question.
What is different in Latino research? Well, I think as a Latino, doing Latino research, I'm much more passionate about the work that I'm doing. And the reasons for the research that I'm doing are very different. I'm not doing it for career advancement. I'm not doing it for the money. I'm really doing it because I want to help my community. I want to give back. And that's been my goal, you know, both in my medical career and in my public health career. And I'm very happy right now to say that I'm leading one of the largest Hispanic research studies in the history of the United States. It's called the Hispanic Community Health Study. It's a longitudinal study of the health of Hispanics 18 to 74 years old. It's similar to the Framingham study, the Jackson Heart study, but we're a group of researchers in 4 cities have recruited 16,000 Latinos. And we are following them now for 3 years, and we've just got refunded for another 6 years. And we will be collecting valuable information about Latinos in the United States, including Latinos of diverse backgrounds, individuals of Puerto Rican, Dominican, Mexican, and a variety of Latinos. And much about acculturation and some of the risk and resiliency that exists around cardiovascular disease and diabetes. So stay tuned.